what I'm going to do today is really just talk about what the Alliance is, what we're trying to achieve through the Alliance, and then also talk about some of the projects that are being pursued under the banner of the Alliance. I would say that it's still fairly early days for the development of the Alliance. And so a lot of this work that I'm presenting is really work in progress, but I can share with you what we're doing. And I would love to hear thoughts and feedback from everyone about all this work. So first of all, what is the Alliance? So the Alliance is set up as a forum for HDRN Canada to engage with our formal partners. So this is really the part of our work which is really about external partners, not member organizations. And so you can see here we have Canada's Drug Agency. Of course, we are one of the members. We have CHIMA, which is some of you may know, but they do they regulate or they accredit health information education programs and also health information professionals. And then we have CNODES, we have CRDCN, the Research Data Center Network, that's the StatCan network. We have CIHI as a member of the Alliance, sort of in the part of CIHI business that is separate to DASH, so the sort of the rest of CIHI. And then we have IRCC, we have CLSA and CAMPATH. And so we have committed working relationships with all of these member organizations. So the structure, so basically, as I said, this is bringing together our formal partners. We do expect, as our formal partners expand over time, that membership in the Alliance will also expand. And then we adopted a rotating chair model. So Michael Schul was the first chair in 2024. And this year in 2025, the chair is Parminder Raina from CLSA. And in 2026, we already have approached the chair for 2026, and we're just waiting to confirm that person. And that, I would just say that rotating chair piece has turned out to be a really great way to engage the membership in the Alliance. So it's really been a pleasure working with Parminder so far. And I think that this has been a really good move, the way we've done it. The Secretariat support is basically the partnerships team. And so even though the chair might change, the Secretariat does not change. So we at HDRN Canada maintain that role in supporting, the operation and function of the Alliance. And so really, what is the mission and purpose? So it's about collective action and collective benefit to the members. And so this is an important point because, like in everything else we do, HDRN Canada is, taking a lead and providing direction, working collaboratively, but nevertheless, taking a lead. With respect to the Alliance, we try very much not to be imposing an HDRN Canada agenda necessarily onto the Alliance. Like, we really want it to come from the membership and to reflect what everyone is, what the mutual interests are of the members. And so the four kind of areas that we have adopted as our focus is sharing. So it's in part about knowledge sharing. It's also about working collectively to strengthen health data policies and practices. And it's also about collaborating on specific projects of shared interest, and of course, overall fostering Canada's health data ecosystem. Last year, we spent some time thinking about how we work together. And so again, this is a work in progress, but this is what we have agreed to so far. So the idea is that all activities of the Alliance are voluntary and flexible. And so while we hope that there may be times when the entire Alliance membership gets behind a project or activity, we also recognize that that may not always be possible, especially because, you know, you may have noticed we have a mix of types of members. So we have government departments and government agencies like IRCC and CDA. And also we have, you know, the big national longitudinal cohort studies, CLSA and CAMPATH, and others. So that people are wearing different hats and have different vantage points in the system and different interests. So in recognition of that, we've said, you know, members can opt out of any action or activity. Like it doesn't have to be everybody agrees to participate or everyone agrees to an activity. And so we find that there are pairings of you know, Alliance members working on things, or like recently we had an opportunity to make a submission to ISED about their AI sovereign compute infrastructure program. And in this case, we had HDRN Canada, CLSA, and CNodes all joined together to produce a submission, and that went in under the banner of the HDR Alliance. So that's an example of some, you know, the way that we might operate with the voluntary and flexible, but we are trying to be collective and coordinated. So we do have quarterly meetings of the Alliance, and we've structured the membership as well. And I think this has worked well for us as well, is that we have, each organization has a member and then they have a designate. And so there are actually 2 people from each organization that are invited to all the meetings and you know, are engaged in all the communications. And so this really helps to make sure that we have at least some representation of all the organizations at the meetings. And so we've had pretty good attendance. But then we have an increasing flow of work in between meetings, and you'll see, I'll talk to you a bit more about some of the projects that are emerging. And as I said, this has to be driven by the members. So, you know, this has been a challenge because, you know, anytime you're starting something new and we're sort of taking the lead, but, you know, we really want the members to you know, begin to sort of drive initiatives. And so it's taking some time to really sort of get members really engaged in leading different projects and activities, but we are making some progress in this respect. And then finally, it's about amplifying voice. So we see the opportunity to not only you know, promote you know, the work and the products that come out of the Alliance, but also to cross promote each other's activities and interests. So we've formed a bit of a sort of working group of the communication leads of all the different members, and we're starting to get a little bit more organized in trying to make sure that we optimize communication opportunities across the membership. Okay, so now into the action plan and the priorities for 2025. So at the beginning of 2024, we developed this action plan, which started with developing this framework for the action plan. So we were trying to figure out, based on some early work we did on agenda setting, how we could create buckets of focus and buckets of work that would last over time and would allow us to pursue specific things, but that, would provide that good foundational framework for the work. And so I think we did decently well here as well, because now, a year and a half later, this framework is still working well for us. And so it's broken into two sort of components. The first component down here is what we call the cross-cutting areas to enable the success of the alliance itself. So, we talk about demonstrating impact to government and funders, support for each other's member initiatives, and developing those methods for working together that I just mentioned. And then over here is the critical focus areas for collective action. So the first one is promoting understanding of the health data ecosystem and data literacy. Here we have pursuing sustainability of the pan-Canadian data and research infrastructure. And then finally, fostering multi-regional data sharing, access, and use. So right now, our activities can nicely sort of bucket under this framework. So, just a snapshot of where we've been and sort of what has been achieved. The inaugural meeting of the Alliance was in November 2023. We did start the agenda setting exercise in 2023. In 2024, we completed the action plan. We added a couple new members. We started a couple initiatives. So I'll talk to you in more detail about the data ecosystem mapping and the Working with Federated Data Forum. And then in 2025, these activities continue, but we've had our chair transition. We reviewed the action plan at the beginning of the year, and that will become a routine for the Alliance, is an annual review and update of the action plan. We set priorities for 2025. We started a new project around impact, which I'll tell you about. And we started to focus down more on producing use case, writing up use cases that are coming out of the Working with Federated Data Forum, and I'll explain that a bit better too. And so the 2025 priorities are to really work on the promotional opportunities. So I mentioned that we had brought together the communications leads, and that will continue to be a thread of work through 2025. I'll talk in a minute about the ecosystem mapping and the Working with Federated Data Forum, also about the impact report, so I won't go through all these. The final thing, which will happen in the fall, is that we're going to have a themed meeting around issues regarding infrastructure for secure research environments. So this is something that several of the members share an interest in, and they wanted to talk about what are our sort of common issues that we're all facing, and what might be some ways forward. And so with this impact work and this infrastructure work, basically we're starting to settle into a little bit of a modus operandi as well for how we kind of do things. So basically what we're doing is we're having a themed meeting on like this topic of shared interest. And then at the meeting, we try to come up with a tangible project or product that we can work on together. And you'll see what I mean in a little bit about that. But that seems to be, working as a good approach for working with the group. Okay, so now let's dive a little further into some of these initiatives. So the health data system mapping. So this one was one of the first things that we hit on. Like, this really emerged out of a very lively meeting that we had around the agenda setting, and there was a strong sense from the members that we don't really have a data system. We have maybe a data ecosystem, and that it's very hard for people to understand, like, data ecosystem. There's a lot of players, and it's not really kind of a coherent picture in terms of who's doing what and how to get things done. So Kai is Anne-Marie Parent basically stepped up and said, she and Kai had a real interest in this area. And so she has been leading this working group, which includes us and CDA, Canada's Drug Agency. And what we've been doing is we're trying to adopt a data ecosystem, basically a mapping approach to trying to make sense of this data ecosystem. And the purpose is to improve our understanding of it, who the key players are in their roles, but also to identify barriers and hopefully find opportunities to improve things. And so we landed on this tool. It's called Kumu. I don't know if folks are familiar with it, but I'm just going to swap in here and share with you. This Kumu tool it's a mapping tool, exactly what it says here, to help make sense of your messy world. Organize complex data into relationship maps that help you understand the problem and also the potential solutions. And so we have been experimenting with this, and we also learned quickly that we had to focus down, because the data ecosystem is massive, obviously. And so what we decided was to choose a use case, which became like Canada's Drug Agency had an interest in basically trying to map their access to data and how they use data and the players that they engage with. So essentially, the first use case that we're working on is Canada's Drug Agency vis-a-vis both the post-market drug evaluation program, but also the data analytics program that we're working with from CanAS perspective. And yeah, so we're basically trying to map this messy world of collab, post-market drug evaluation, HDRN Canada, and other players, all supporting Canada's Drug Agency and sort of how it works. So that work is ongoing, and hopefully we're intending to present this first use case to the full Alliance meeting on July 9th. So after which time we may be able to share more of those results, but right now we're not quite ready yet. We are. So we have followed this kind of project cycle, exploring Kumu. It's taken quite a bit of time to adapt, like to, figure out sort of how to use Kumu to best effect in our case. And so we've refined our strategy a few times, really, and then we've met with folks from Canada's Drug Agency and from the post-market drug evaluation program. We've met with them several times, and we're now at the point of validating our kind of early map and trying to then distill what the map can tell us in terms of both challenges and opportunities for improving data access for Canada's drug agency. So that has been a really interesting piece of work. We're very grateful to Anne-Marie Parent and Kai for stepping up and leading this work. And I think it has great potential. Once we kind of get this first use case under our belt, I think it will be a good tool to then apply to other sort of lenses on the data ecosystem. So the next thing that we started was what we're calling the Working with Federated Data Forum. And so the idea here really came from the fact that, you know, some of our partners are still really looking for, you know, solutions to the federated data arrangements. And some of them, like CAMPATH, has really been pushing hard for us to be pooling data. And so in response, we thought, you know, we really need to have a place where we can have dialogue about the challenges in working with federated data, and also to highlight the potential for things like federated analysis and common data models and other sort of methods and techniques to overcome the challenges of working with federated data. So this really, well, I guess it shouldn't be that surprising, but this has been a very popular meeting. Like, we've now extended it. So we started out with, you know, the invitees were just like the alliance members, right? And then we would add, you know, whoever was presenting or whatever, you know, and the use cases we're working on are from the membership. So that was important as well. But now, like, there's more people expressing interest in this. So we've added both FAC and Health Canada now attend this. They're not technically, well, I should say they're not yet technically members of the HDR Alliance, but we're working on that. And they have the, you know, this is kind of, this has really been a way to kind of bring some of these key partners into our orbit, and for them to be exposed to the dialogue and the kind of things that we're doing. So what are the use cases? So the first one we started with was small cell reporting, particularly when doing work on rare disease. And so this use case was brought forward by Canada's drug agency. It's sort of stemmed out of the work we did for them. The first contract we did for them, which was spinal muscular atrophy, and there was a lot of small cell suppression in that work. And so basically, we started to have some dialogue around the Working with Federated Data Forum, and that has essentially sparked work that Ted McDonald, Robert Platt, Rafiq Saskin, Luc Mondor, and others are doing to develop a method for HDRN Canada and its sites to use in order to overcome small cell reporting issues. And so this is real. There's a lot of interest in this work as well. And so right now they've been testing the method with synthetic data, and then there's some more steps, and then we'll write it up and actually start. We're also starting to deploy this or hoping to deploy this method in some of the CANAS projects that are coming up. We also presented to the forum the OMOP work for the replication study for spinal muscular atrophy, because again, like CDA had a great interest in that. And we had done that work under the OMOP implementation. So we brought it here to the forum so that CDA could be exposed to it. And we've had some interesting discussion around that. And we've had sort of more discussion around common data models as well, like Robert Platt has presented how C-nodes work, C-nodes experience, I guess, and perspectives with common data models. Where we have scheduled to bring to a future meeting the results of the distributed analysis for the Awadala project, which is a COVID-19 project, but it's a CAMPATH project. And so, CAMPATH being so keen to pool everything, we wanted to demonstrate that what we can achieve with distributed analysis. So JF is leading a team, and they are gonna, hopefully finish this soon. It's allowing a lot of bugs to be ironed out about doing this distributed analysis multi-regional. Anyway, and then we're moving into a use case on pragmatic trials. And so we've had Amit and his team, Amit Garg, have introduced their use case to the group. And at the next meeting in June, we will dive further into the pragmatic trials use case. And again, the point here is to, these use cases are bringing forward real projects, real challenges that people are having in working with federated data. And then the group sort of discusses how could we sort of tackle this. And, it has in some cases sparked actual project work that then tries to pursue those solutions. So this has proven a good method for engaging people and sort of really starting to get some traction. Well, this is, I mentioned the small cells working group. So HDRN Canada is leading here, but it includes C-nodes, ICS, and Health Data New Brunswick. And, they're developing this method, and the next steps are to develop the guidelines and consider when we can use it and actually apply it to a CANAS project. So this has a lot of potential. Okay, so the next spotlight is the newer piece of work that we're taking on, which is we're calling it Demonstrating Organizational and Collective Impact. So at our April 2nd meeting, we had, this was our themed sort of discussion around organizational and research impact. We had Michael Schul gave a really interesting presentation on how ICS is aligning their impact reporting around the DORA framework. And I'll talk about the DORA framework a bit more in a minute. We had Parminder talking about the social policy, our SAGE policy impact tool, along with a whole lot of other metrics that CLSA is using. And then we had a roundtable discussion about the approaches that all the members are using. And we decided to try to produce together an impact related product. And I'll talk about the product in a minute, but the themes that came out of our discussion were pretty interesting in that most of the members were experiencing the same challenges in trying to articulate their impact, and so there was a pretty good convergence on some of these themes, and a strong agreement to try to work together on this stuff. So basically a sense that we need to move beyond traditional metrics, and that's really what the DORA framework in part addresses. Also a recognition of multi-layered and long-term effects in terms of the work that we're doing, the need to have a diverse set of tools that allow us to really tell the full impact story that go beyond just metrics, the need for flexible frameworks to highlight unique organizational stories. So this really speaks to the, again, that point that we have different types of members. And so we're trying to land on an approach that allows all the members to see themselves in this one product. And then, cautioning about the one size fits all, and then, making sure that we're incorporating indirect sort of impacts like capacity building and so on. And so the shared impact product is going to first facilitate learning. This is going to be a really good way for us to get to understand each other better. We're interested in the work of individual member organizations and also the collaborative actions that happen between members. So for example, between HDRN Canada and CLSA, or HDRN Canada and CAMPATH, like what have those partnerships produced that will be part of this as well. And then this, we think, will also set us up nicely for future measurement of collective action. So as we get more sort of adept at doing collective actions, we'll have a basis for knowing the impact that we're having. And of course, it will inform, future priorities and opportunities for collaboration. And also it's just going to be, we see this as potentially a really good PR kind of document. Like it can really help us to promote the work of the Alliance and the individual members. So like a lot of you may be aware of the DORA framework for research assessment, but this is it in a snapshot. It basically tries to get at a broader sort of approach to research assessment. So you've got the scale of influence axis here, which goes from, like direct contributions like journal articles, all the way up to what they call scaled magnitude. This is where you have like leadership roles, or you're doing transformative methods and things like that. And then the new audiences axis is, again, like the box here is about disciplinary or field specific audiences, all the way through to external to academia, which can be the public, social media, and things like that. And so I won't go into all this detail, but anyway, this is an inspiration for our work at the HDR Alliance. So this is actually what we are going to try to collect and sort of assess and sort of, understand. Is we're using our action plan framework, the cross-cutting actions. So basically the lens is we're asking members, tell us about your impacts in these 3 areas of our action plan. And then we're asking them to tell us, about the scale of influence and about the audiences. And we're asking them to consider the contributions of their single organization, of collaborations between 2 or more members, and ultimately of collective actions, but we don't really have a lot of collective actions yet. So this is, again, this will be setting us up for, being able to weave in collective actions later. So we're going to be collecting this information over the next couple months, and then reporting to the July Alliance meeting on sort of like preliminary sort of results of this work, and hoping to finalize it by September. And then finally, it's just, as I said, we're planning a themed meeting in October around common technical issues associated with secure research environments and federated analysis environments. So stay tuned for more on this.